Once you start taking it, if you stop, you realize how much it was helping you because all those pains and stuff start coming back.
I've always felt very tired, and I just don't have any energy, and that's all changed. I can't remember the last time I felt as good as I do now.
Right now, Balance of Nature is offering free shipping and 35% off on any new preferred order. Go to balanceofnature.com today and use discount code USA.
While you have free time and you're sitting at home and you ponder what kind of gifts to buy for someone, PatriotDepot.com has you covered from puzzles, games, novelty items. If you're looking for some unique style items when it comes to the president, for more you can check out PatriotDepot.com. Call 844-377-8052. That's 844-377-8052 or PatriotDepot.com. Use promo code USA.
White House trade advisor Peter Navarro is no fan of John Bolton's new book.
This is deep swamp revenge porn on the part of John Bolton. He did the same thing with the Bush administration.
Speaking on Fox News, Navarro claimed that Bolton begged for the role of national security advisor under President Trump. Navarro is also accusing Bolton of trying to put together a coup in Venezuela and other countries.
This is not comporting with the tradition of people serving in administrations. He's basically throwing grenades at this administration to make money with Simon & Schuster. He knows exactly what he's doing, but he's done it before, and shame on him.
The administration is suing to have the book not released next Tuesday. House Democrats are launching a big infrastructure bill.
That is so important for a country. It's job creating in its essence, but it's also commerce promoting.
Democrat Speaker of the House Nancy Pelosi there, she was short on details regarding the bill. This is USA Radio News.
Working from home? I'm Chad Dodd, veterinarian and consultant to Limp Bells. Here are some tips for keeping your dog fit while staying at home. Find 15 minutes twice a day and walk your pet at a decent pace around your place. Play hide and seek by hiding some kibble or favorite toys and letting your dog find them. If you have stairs and your dog is mobile, walk up and down twice a day for 5 to 10 minutes. Or better yet, try a power walk on your terrace or backyard for some fresh air. There are more helpful pet care tips at youmove.com, spelled youmove.com.
Former Vice President Joe Biden's campaign says he plans to accept the Democratic nomination for president in Milwaukee. The city is scheduled to host a Democratic convention in August. However, the coronavirus pandemic is forcing the DNC to consider options for how to hold the convention and limit the spread of the virus. Now, President Trump is planning to hold his convention down in Jacksonville, and Lee Carter, who's a pollster, shares with Fox News what's on the minds of many voters.
Yeah, I think the number one issue that's going to make people vote is about safety. And I break it down into three categories. There's your physical safety, your emotional safety, and your financial safety. Who do you think is going to make you feel most secure on those categories? Physical is about how do you feel about who's going to handle COVID the best way, who's going to handle all of the protests in the best way. Financial is about the economy. And emotional is who's going to let me be who I am openly and without judgment. Depending on which party you sit on and where you sit, you're going to feel differently about who's going to best do that for you.
Nebraska Republican Governor Pete Ricketts said this week he will not distribute any federal funds to local governments that mandate the use of face masks. The governor saying cities and county facilities cannot require their customers to wear a face mask if they want any part of the $100 million in federal COVID-19 aid that the state received earlier this year. The governor is encouraging people to wear a mask, but does not believe the failure to wear a mask should be the basis for denying taxpayers services. For USA Radio News, I'm Tim Berg.
The following is an America Matters media production. The views expressed do not necessarily represent those of the station or its advertisers, although we think they should. But that's the opinion of America Matters Media.
Welcome to this week's episode of Rush Hour. I am your host, Kelly Rush, and we are a production of America Matters Media, the home of quality conversation. And you can check us out on the internet at americamatters.us. That's americamatters.us. We are also on Facebook at facebook.com/Reno Rush Hour. And yes, you're here.
I'm here.
I made it.
You made it just in time.
Grand entrance, right? My timing is perfect.
Perfect timing. I love that. This is an interactive program. You can check us out at America Matters, like I said, americamatters.us, and you can call in toll free from anywhere in the world, 844-790-TALK. That's 844-790-8255. You can text us, 775-237-2266. And you can also drop us a line at the Facebook comments box on the watch party. As soon as I get that started, I'm a little discombobulated here because we were really cutting it close. And it is my favorite day of my favorite time of the month. It is Third Thursday. Nevada Advanced Pain Specialists with Dr. Dennis Patterson, and he's here.
How are you?
I am wonderful. How are you?
I've had better days, but now that I'm here with you, I feel amazing. So
I am so glad you're here. And we have been joined by Flo Onyx. I love it. Renee Swackhammer. Did I pronounce that right?
Yes, you did. Very good.
Awesome. Clinical specialist with Flo Onyx, and we're going to talk about pain pumps today.
Absolutely.
And I would love one of those. I would really, really love one of those.
Actually, with your conditions that we've always discussed, I mean, you've got pain in multiple areas, and a pain pump is something that can help multifactorial pain. It's different because a lot of the procedures we do are for focal pain or for specific issues. And in this case, a pain pump can help any kind of pain.
That's cool. Look at this thing. That's really neat. I can't wait to talk about this. And then we have Nicole.
Hello.
How
Good to
are
see you
you?
again. Doing great.
I'm so glad to have you with us as well.
Thanks for having us.
Nicole Mangelli, and you are the Director of Marketing for Nevada Advanced Pain Specialist, nvadvancedpain.com, nvadvancedpain.com. And we're going to talk about how to alleviate pain, which is one of my favorite topics. So welcome. Everybody, welcome. So, how are you?
I'm good. I think over the last couple of weeks, I've seen that things are getting back more to normal. I don't know if you've seen that in your schedule, but it seems like I've gone from a few emails a day to back to hundreds of emails a day.
I know. Honestly.
Patients are coming back to the clinic, and I'm seeing that, where I used to be able to kind of work out in between patients during the day because I'd have gaps, I can no longer work
Not
out.
so
I got to
much,
find time in nights and mornings before or after work.
So that's, I want to say it's good that you're busy, but
Oh yeah.
That also means that people are in pain.
Correct.
Well, if Patterson is busy, they're in less pain.
Well,
that's hopefully the goal.
That means you're getting them out of pain, which
Yes.
is a great thing.
Yes.
And again, I'm going to mention NV Advanced Pain and Nevada Advanced Pain Specialists, the biopsychosocial model, which is my favorite thing on earth. I love that, which means multimodal specialties that you deal in. So you don't just throw drugs at somebody. You don't just say, here, we're going to operate on you. We don't just say, here's this one treatment, get out of my office, you're done.
Correct.
You treat the whole patient.
Yeah.
It's a holistic model, which is the way to go. It's the only way to go.
Correct.
And it's the future of medicine and treatment. So I love that.
Pain patients, it besides it affecting them, it affects others around them. So, if you have pain, you are usually not feeling good about yourself, which then you can develop depression over time, which then you can become anxious about your situation, and then the way you behave kind of affects the people around you, especially your loved ones and your family.
It radiates outward. It really does. And then also I'd like to introduce you, Renee Swackhammer of Flo Onyx, and let's talk about who Flo Onyx is.
Flo Onyx, we're the medical device company, and we're the ones that produce and manufacture the pump, the pain pump, which Dr. Patterson implants, and it has a catheter at the little pump stem. That comes off the stem, and then it leads up into the interthecal space, and it delivers the medication. So there's no PO medicines. So all the medication goes in a little reservoir in the pump.
Will you move the mic up to your mouth? There you go.
Is that better?
Perfect.
So instead of taking by mouth the medications, they are put put in the reservoir of the pump, and then given at a dose, according to Dr. Patterson, delivered directly in an intrathecal space to the opioid receptors. So it really alleviates. Recently, we had a patient, actually a cancer patient, and constipation is a big issue, and it hurts. It's uncomfortable.
No kidding.
And for this particular patient, it made a huge difference at a time in his life that it really mattered. And then also the other thing that I like about the pump is it keeps opioids off the streets. There's no prescriptions, and I have heard a couple of times that some of these patients, they really need their medication, and then when they go up to the pharmacy and they are getting their prescription, some of them have been really looked at with a raised eyebrow.
You're not kidding.
As if, well, exactly.
It's crazy.
Exactly.
It really is. I mean, you
just not.
You
not
feel like a criminal.
Yes.
And you have
already
to
feel bad enough.
You feel bad enough, and to think that the pharmacy staff, even, I've had that experience more than once, and you have to be careful leaving the pharmacy.
Yeah.
You have to be careful.
You could have patients, other people follow you that see that you got those medications and try to rob you or
That's
steal them
right.
from you.
Or even if you leave the pharmacy and, you have to go other places and you have the CVS bag in your car.
Yeah.
You don't know. It's just a strange situation. It's
It
just
is.
all around.
It
So
is.
we will be back for the second segment of today's Rush Hour with Nevada Advanced Pain Specialists and Renee Spackhammer of Colonics talking about pain pumps. Please hang with us. We'll be right back.
Hi, I'm Dr. Dennis Patterson. I'm the founder and owner of Nevada Advanced Pain Specialists. At Nevada Advanced Pain Specialists, we take a comprehensive approach to treating patients with chronic pain in the greater Reno, Tahoe area. We believe in the biopsychosocial model. This means we use multiple disciplines such as massage therapy, physical therapy, behavioral health, and medical treatments to treat your chronic pain. A plan of care is tailor-made for each individual patient. We always recommend conservative care first, but offer minimally invasive treatments when necessary. We are your one-stop shop. If it hurts, we can help. We pride ourselves in providing passionate care and making you feel welcome and understood. We are located in Reno and in Sparks, so give us a call to schedule a new patient consult at 284-8650. Again, that's 284-8650. Or visit our website at nvadvancedpain.com. We hope you choose Nevada Advanced Pain Specialists to be your center for injury rehabilitation. nvadvancedpain.com, 284-8650.
Businesses, writers, check this out. Go to lrpnv.com to get your printing, publishing, and professional services today. Need a virtual office? A place to receive and forward your mail with professional address and suite number for your business? Someone to answer your telephones? Want to rent a conference room for only $15 an hour? What about that book you've been wanting to have printed? LRP Printing and Business Center can do it for you, and they have a professional assistant on site daily, Monday through Friday. Just call 775-356-1004. Need copies, business cards, invoices, books, booklets, or graphic design to help brand you or your business? Just call 775-356-1004 or go to lrpnv.com. With a great selection of new and used books, you can get your printing done and a book to entertain you in your time off. And don't forget, you could have your business sponsoring the Bookhound Radio Show, just like Andrew Martoni, author of Little Man on the Map, does every week. Just go to lrpnv.com. That's lrpnv.com or call 775-356-1004. They'll provide solutions for your business and writing projects.
Hi, this is Eddie Floyd. Let me tell you about my favorite non-profit public charity, Wainema Wild Horse Sanctuary, located on the Forsyth Ranch in Hallelujah Junction area. And please go to www.wainemaranch.com. That's WYNEMA ranch.com.
911, what is your emergency?
My kid shot himself.
All right, where's the wound, sir?
911, what's your emergency?
Please help. My son shot his brother. 911, what is your emergency? Okay.
911, please state your emergency.
Every day, 8 kids and teens are unintentionally killed or injured by loaded and unlocked guns.
It wasn't locked.
Learn how to make your home safer at endfamilyfire.org. Brought to you by the Ad Council and End Family Fire.
This is America Matters Media on AM 1180 KCKQ, a Lotus broadcast station. The power of radio since 1967.
Are you shy and don't want to talk on the air? Text us your questions or comments to 775-237-2266. Now back to the show.
And welcome back to the second segment of today's Rush Hour with Nevada Advanced Pain Specialist, Dr. Dennis Patterson, one of the best in town.
Thank you.
We are talking about pain pumps. We've got Renee Swackhammer of Flowonix, and this is really cool stuff. And it helps avoid a lot of issues when you're dealing with things like side effects from opioids, and like you said, constipation.
Yeah, another thing too also is the fact that people might not have won't have the high, they can actually think they have better clarity, and cognition is okay, and they can drive and they can work. One gentleman I know of, he can work, and that's a good thing.
Absolutely. Well, I mean, let's talk about opioid receptors in the brain and how they get affected by that overstimulation and that constant use, and how that, what that does to the brain. It alters, those, it alters the way the brain operates, and how those, and tolerance, what tolerance is, and how that happens.
Yep.
So you're exactly right, Kelly. So there's a couple of things that I want to point out here. Is number one is when you keep taking oral medications around the clock, there's always some form of medication or opioid in your system, and they bind to certain receptors. And the more they're there, what happens is a thing called downregulation. Downregulation means those receptors start to disappear. And when they disappear, that means in order to stimulate them, you need higher and higher doses, which leads to tolerance. And so that's one issue that you see with patients, is that, what used to, 2 pills a day used to work, now it's 3, now it's 4, and it just keeps multiplying. Second thing that happens is these will cross the blood-brain barrier. And you're exactly right. The longer they trigger the brain, you end up with a condition called opioid-induced hyperalgesia, meaning that your pain level actually drops. And that's very tough to treat, because when you see these patients, you say, hey, I think these pain medications are making you hurt worse. They're actually not helping you. And they have a very hard time understanding that. To them, that's me telling them I'm going to take their oxygen away, because they see these pills as their lifeline to pain relief, and they don't realize that at this point they're doing more harm than good. And so when I tell them that in order to feel better, I need to decrease your dose, they kind of freak out.
Right.
And it's not their fault. It's the brain chemistry has been changed. And so now it's kind of like your thermostat. What used to be comfortable was room temperature 72. Now their thermostat is set at 76. And they don't realize that it needs to get back down to 72 to normalize. And I even see patients that when I do procedures that are very innocuous, that like if I did them on somebody who's not on pain medications, that procedure is no big deal. And these patients, even when I just touch them with my hand on the skin before I even touch them with the needle, they
absolutely.
And it's their pain threshold has been dropped by long-term use of the pain pills.
Yes, I know what that's like. I do know what that's like, and it's horrible. It's really horrible, and you just, I have weaned myself down from my dose, and then I have to go back up, and then I wean myself down, and I mean, it's a game. It's a game I play with myself, and it's bad. It's bad, and I don't know what I've done to I don't know what my brain is like. I don't know, I have no idea. I have no idea what's going on.
And this is why I love pain pumps, and I'll explain that to you. Is that patients who have pain, if you take them orally, it's going through everywhere. And as we're talking about, it causes side effects. It can cause, side effects in the GI system. It can cause constipation. It can cause problems when it crosses the blood-brain barrier. One, it can cause respiratory depression. So if you're mixing with other medications, it could, cause you to stop breathing. It can cause cognitive issues. It can cause endocrine issues. So now you've got your hormones are out of whack, and it causes dry teeth. So your dentition.
Oh, my dentition is terrible. Yeah. I'm missing teeth. I've got a cavity fell out, and I've got this tooth with a hole in it, and I can't afford to even get it fixed. I mean, I'm a mess. I am an absolute mess right now.
So you deliver the medications into the spine, into this, what's called the intrathecal space. And the conversion, what is about 300 milligrams orally you'd have to take, it's only 1 milligram. So it's a 300-to-1 difference. So you can do much lower doses with the pain pump. Plus, this isn't going out throughout your entire body.
Right.
It doesn't have to be metabolized. So now the cognition problems go away, the respiratory depression is less likely, the constipation's not an issue, the hormonal changes with the endocrine system all resolved.
Well, and as a 52-year-old woman, hormonal issues are a huge thing because, I am most likely, perimenopausal right now, and, I'm on hormone replacement therapy, and I've got all kinds of crap going on. So, it's a thing. It's really a thing to be on opioids.
And so think about this too. So getting back to our earlier stuff about what pain medications do to the receptors. So this pump, and this is why I love their product so much, Fluonix, is it has the ability to be totally stopped, and I can give a bolus of medication throughout the day. And their competitor on the market cannot be turned all the way off. So there's always something trickling. So if medication is always coming out, it's always trickling the receptors and cause downregulation around the catheter. With theirs, I can turn it off completely, and so the receptors there's less likelihood of them being downregulated. And so instead of medication given around the clock, I can give them a large bolus dose, which then makes them feel good for a period of time. Then the whole place is cleared out. The receptors don't get downregulated because they're not getting constantly pounded with medication. And then, as their pain starts to come back in, I can give another dose. And I can program it so I give them a bolus once every hour. I can give it every 2 hours. I can give it every 6 hours. I can give it, and then if I want, I can give like a larger bolus at night before they go to bed to help them sleep through the night, a lower bolus dose in the morning. So there's flex dosing. So it allows me to be in control where you really can't, take a quarter of this pill in the morning, then take 3/4 of that pill in the afternoon. I'm I can control it, and I can get patient feedback. Or, hey, what do you do on a daily basis? Well, every day, I get up, I try to go to the store, I try to be active between 1 and 5. I can make sure the medication hits them at 12:30 so that they feel good to do those activities. So I can even time, work around their schedule, the time to give them the medication when they actually need it.
And how does it, go ahead.
I was just going to, in addition to that, as you were just pointing out that all this mental, it takes a lot of energy is what I was hearing you say about thinking of your pain, you're constantly reminded, and what are you going to take? That's a lot of energy put out for
Carrying
that
your pill,
to address
your
it.
pill with you.
Yeah.
Oh, I forgot to take it. Why am I hurting? Oh, I forgot to take my pill 2 hours ago.
Whereas when you have, as he was pointing out, it takes thinking out of it.
Oh, absolutely. And I am a genetic fast metabolizer.
Yes.
So it says take every 6 to 8 hours.
Right.
I take that pill within 2 hours.
Yeah.
It's gone.
So this bypasses your metabolism system because it's going in the intrathecal space versus having to get absorbed in your gut, then get processed in your kidney or your liver to become an active metabolite. So that's the great part about it.
Wow, that's amazing. And how does it work? Like you said, you are able to control it.
Yeah.
Program.
Yeah. So
how does that?
So basically, this is also kind of like the stimulators we talked about previously, where you come into my office and actually instead of doing an epidural, I just go a little bit deeper, get in the intrathecal space with my needle, and I inject a bolus of medication. At that point, I have the patient kind of relax for like an hour, let the medication kick in, and then I have them start to be active. And typically, I'll even have them see my physical therapist that day. So my physical therapist will see them a day or two before, kind of put them through some exercises and see how much pain they have and how well they perform. After I do the injection of the medication, then I have them go see the physical therapist again. They do the exact same exercises. When they're done, I ask them, so how did that feel compared to the other day? And a lot of times they'll be like, oh my God, I didn't hurt as bad. It was easier for me to do it. And then I ask the physical therapist, what did you see? They're like, oh, they performed the exercises much better than they did the other day. And on the flip side, I mean, if they don't improve, then we wouldn't put the pump in them. We just know they're not a candidate. But for the ones where they get significant improvement, then we talk about implanting it. And then when I implant it, I got several different choices. There's a non-opioid option that helps with neuropathic pain. It's a medication called Prialt, and that's on label. And then there is morphine as the opiate that's on label. But you can also do hydromorphone, fentanyl. And you can even mix it with bupivacaine, a numbing medication to help out, and then clonidine, which is a medication that can kind of help the medication stick around longer so it's not absorbed as quick. It's a blood pressure medication typically. And so there's a lot of different options. You can actually change, doses or change concentrations over time to give the patients more or less relief depending on what's happened in their life. And it really honestly is one of those things that you can adapt as their disease progresses or regresses, either way.
And where does that whole thing get implanted?
Yeah, so with the trial, you just doing a needle, take everything out, nothing permanently done. But this, you're exactly right. You got to implant it somewhere, and this is a 20.
Yep,
I'm assuming,
it is.
So there's a 20 and 40 ml choice, and usually for most patients, I want to pick the 20 because it's the smaller of the two. So typically, where I usually try to hide it is I try to hide it between their rib cage and their iliac crest, or you can put it in the front of the abdomen. I try to avoid the front of the abdomen because I find that people get a condition called Twiddler syndrome, where then they start to play with it. And they can, and if they flip it upside down, then I can't. When they come to fill it, I can't access the reservoir to fill it, and then we've got a problem.
Gotcha.
So I usually try to put it in the side so they can't interface with it, and it looks intimidating. But honestly, I can't think of a single patient who's ever complained of having it in that area, even if they're really skinny.
Pacemaker or
it's just like a pacemaker.
Gotcha. Well, we've got to go to another break. We'll be back for the second half of today's Rush Hour with Kelly Rush and Dr. Dennis Patterson with Nevada Advanced Pain Specialists and Flowonix with Renee Swackhammer. After these messages, please stay tuned. We'll be right back.
Destination Midtown. Experience the difference. Reno's premier shopping extravaganza. Everything imaginable and more. Midtown matters. Get down to Midtown.
Ponderosa Meats, the anchor of Midtown since 1954. USDA choice, USDA prime cut. Ponderosa grass-fed beef. Call 775-322-4063. Ponderosa Meats, tradition, quality, and prime service.
Midtown Reno. Experience the difference. Get down to Midtown. Midtown matters.
It's sweet. There's no place like it. And as we all know, it's where the heart is. Home. It matters. I'm Grant Brewer with Home at Last, a housing program of Nevada Rural Housing Authority. Join me and expert guests every Tuesday at 4 p.m. on KCKQ 1180 for Home Matters, a show dedicated to all things, home. Each week I chat with the industry's best. Lenders, real estate professionals, builders, insurance experts, home inspectors, developers, and specialized housing program experts. They grace the mic and we dig into today's hot housing topics. Tune in to Home Matters each Tuesday at 4 p.m. at 1180 a.m. KCKQ, the home of community radio. Or listen live and listen again online at americamatters.us. Join us.
Welcome to my house. It's my house.
Ready for a live game of Clue? For nearly 30 years, Funtime Theaters held private and monthly dinner murder mysteries. Each night is different, and each event includes dinner and a show. You're the detective, and your job is to figure out who did what to who and why. At the end of the night, a super sleuth and not so super sleuth are awarded prizes. This is a great event for a birthday or holiday party and team building events for your office. Visit funtimetheater.com to make your reservations and use promo code RADIO for $5 off each admission.
Hey, Dr. Phil here. I help people solve difficult and trying personal problems every day on my TV show, but there's one problem that's just got me stumped: childhood hunger. Nearly 16 million children in America struggle with it. That's 1 in 5 kids who may not know where their next meal is coming from, despite the fact that there's more than enough healthy, nutritious food out there to feed them all. Now, I don't know about you, but that is unacceptable to me. Luckily, the Feeding America network of good people is out there collecting surplus food and giving hope to hungry children and their families at local food banks all across the country. But let's face it, they can't do it without your help. Join me in supporting Feeding America and your local food bank at feedingamerica.org.
Brought to you by Feeding America and the Ad Council. Together, we can solve hunger. Together, we're feeding America.
This is America Matters Media on AM 1180 KCKQ, a Lotus broadcast station. The power of radio since 1967.
Want to expand your advertising dollar? Sponsor this or any America Matters program by calling 775-827-8900, extension 2. Now back to the show.
And welcome back to the second half of today's Rush Hour. I am Kelly Rush, and I am here with Dr. Dennis Patterson of Nevada Advanced Pain Specialists. And it is my favorite day of my favorite part of the month, third Thursdays. We do this every month. And nvadvancedpain.com, nvadvancedpain.com. And as I said at the top of the show, this is an interactive program. Please do give us a call with any comments or questions that you may have. Toll free from anywhere in the world, 844-790-TALK. That's 844-790-8255. Or you can text us, 775-237-2266. Or we have a watch party going on Facebook. You can drop us a line in the comments box there if you want to have us answer you there. And we've got Renee Swackhammer of Flowonics. We're talking about pain pumps today, which is a really cool way of getting your medicine delivered if you don't want to do it orally and deal with all the side effects, which is a great thing. Really great thing. And this is Nicole Mongelli, who is Dr. Patterson's Director of Marketing. So she's too quiet over there, but feel free to...
I'm trying to monitor my own watch party.
Okay,
so.
That's cool. That's cool. And I get it. But feel free to chime in if you do have anything to say. So again, we are talking about pain pumps, and it's part of Dr. Patterson's biopsychosocial model of treatment, which is, like I said, it's the holistic model that you use that is so effective, and like I said, it's the future of treatment and medicine as we move forward. Going forward.
It is definitely the way that patients should be approached with pain. You got to address their pain, but you also got to address the other issues that surround the pain. And if you don't, you're never going to get them better.
And so, again, let's talk about the different types of medicine that are available for use in the pain pump. It's not just opioids. It's multiple different types of medicine that you can use. And I liked the one that you mentioned that was sort of like a Novocaine. It sounded like to me.
Yeah, so a couple things that I'd want to differentiate between is that, basically the type of condition the patient has would kind of dictate what kind of medications I'm looking at to give them. And so if you're looking at indications with the pain pump, you're looking at cancer pain. That's probably the number one reason to use the pump. Second reason is chronic pain. And the third reason would be, spasticity. If a patient has had a stroke or they've had cerebral palsy and they've got, tight muscles that they're unable to move appropriately. So let's talk about cancer pain. So cancer pain is probably going to be more your opiates. And as, end-of-life care hits, cancer is very painful and it causes really sharp exacerbations of pain. And so having opioids at high levels in those patients is definitely going to cause a lot of cognitive problems, and it's going to cause constipation. And your end of days, you want to be able to enjoy your loved ones. And if you're, on oral meds and you're cognitively not there, you can't enjoy your final days on earth with your family members. And then on top of that, if you end up constipated, then the next thing you know, you're in the emergency room to be disimpacted, and it's just
Just,
not a
no,
good
just-
situation.
no thanks.
So with cancer patients, I'm looking at doing opioids, strong ones that are fast acting. So probably for them, you're looking at probably more hydromorphone or fentanyl would be good options. Morphine's fine, but it's just not as fast acting as the other two. And then usually I try to combine those with the bupivacaine, because the bupivacaine can also cause that numbing. It's a long-acting numbing medication that can give them relief too. So every time they get a bolus of medication, they can just feel numb in the area where they have pain, plus they're getting the pain medication to help with their spikes. The other thing we didn't touch upon too about the pump is, even though I control it and I can give them I can set what the pump does and they set it and forget it. There is another option that comes with it. It's called the PTC, and that's the patient control monitor. And basically, I can give the patient the ability to give themselves boluses of medication. But I control how often they can do that, and I can lock it out so they don't just keep hitting the button and overdo it. So patients with cancer pain, like I can give them the ability that when they have those sharp exacerbations, they can, basically
Kinda
zap
like when you're in the
themselves.
hospital.
Correct. It's exactly like when you're in the hospital and you have an IV and you have the pain drip next to you. It's the exact same concept. The second thing to look at is chronic pain patients. And so chronic pain patients, I try to break down, is their pain neuropathic in nature? That it's more of a nerve injury. If it is, then I'm going to look at pre-alt. If it's more mechanical and or, a mixed situation where there is some nerve pain, then I'm probably going to do the medications with the opioid medications along with the bupivacaine. Now, the spasticity scenario that we talked about, those patients need baclofen. Baclofen is a potent muscle relaxant, and the pain pump is one of the on-label conditions. So, if you have focal spasticity or or very mild, you could do oral or probably even Botox injections into those muscles. But if you've got a pretty severe or generalized, you're going to need the pump to deliver the baclofen into the intrathecal space.
Sure. And how long or complicated is the surgery to implant the pump?
Oh man, Renee can probably tell you it doesn't take me longer than 30 minutes.
He's speed racer. He's quick.
Sometimes it's good to be fast at things, right?
Sure. And is it an outpatient surgery? Is it an overnight?
Yes.
It's an outpatient.
Well, so the way I treat it is I want it to be an outpatient procedure for the patient. Nobody likes to stay in the hospital. So if you come in to have the pump implanted, I put the medications and I turn the pump on, they wouldn't let you go home because they want to monitor you to make sure you're not going to have any side effects or it's not going to cause some problems. So how I do it is I actually take the patient in the hospital. I actually get the pump implanted. I have the medication. Renee will then program it to get the medication to the catheter tip. And then I just give them oral medications like a regular surgery, 1 to 2 every 4 to 6 hours over the weekend. So I usually do these on a Friday. They come in Monday. We take the oral medications. We get rid of it, and we turn the pump on. Then they'll hang out in my office for like an hour or two. And so I usually start it at a lower dose to make sure that it's safe. And then I see them about if it's a cancer patient, I'll see him about twice a week to rapidly increase the pump to help out in a safe manner. If it's a chronic pain patient, I'll probably see him every 1 to 2 weeks to slowly ramp up the pump. So if it's a chronic pain patient, it may take 4 to 6 weeks for me to really dial this in. If you're a cancer patient, it's probably going to take 1 to 2 weeks because I'm going to be as aggressive as I can on increasing the pump.
And how big is the scar, or how it's?
Oh god, it's about 5 centimeters. I gotta. It's about as wide as this is. It's because I gotta slide it.
Sure.
Slide it down in there.
So, but it's just a very simple, quick.
Yeah. Very simple. Very straightforward. Like I said, I don't think it's ever taken me more than a half hour to implant one. I felt bad. I think Renee was gone out of town one day, and they had to find somebody to cover my case, and they flew a guy in from Jacksonville, Florida, from the company, and he showed up, and I was done in 29 minutes. And I was like, man, you flew all the way across the country for 29 minutes?
Wow.
Right, that was Jacob. He's quick.
I was like, I feel bad for you. That's a long trip to see a quick procedure.
And how often do you do these?
I do about 1 or 2 a month. Honestly, I'd like to do more. And actually, we're right now involved in a research study with the company, and I'd like to highlight that today. It's a study called Prosper, and actually, what we're looking at is medical health care costs with a pump versus conventional medical management. So anybody who's got chronic pain, who's on oral meds, if they want to be a part of that study, they are more than welcome to be a part of it.
Wow.
So what would happen is we'd give them the trial, we'd see if it worked. The hard part about the study is then you get randomized either to the control arm or the pump side. If you get the pump side, you get the pump put in, and then we track, for the next year, how much your medical care costs for your chronic pain, how many times you go to the emergency room, and the side effects and other issues you deal with. And then if you end up on the medical management side, you can get the pump, but you're just going to have to wait a year. So now you continue on the oral meds, and we try to see how much your medical care costs, how many times you go to the emergency room, and all that. And what we're trying to see is we think that patients who get a pain pump don't need to be seen in the office as often. They get weaned off medical care. Their pain isn't as severe. They don't end up in the emergency room for exacerbations. And we see that, the cost of taking care of these patients, because their pain is controlled, is cheaper than a patient who is on oral meds.
Interesting. Very interesting. Yeah. How about that? Do you have they started? They
started enrolling patients, and unfortunately, we got signed up right at February, March, and then COVID hit.
Oh, of course.
And it just kind of derailed the study. But now that things are opening up, we're really trying to promote it and get patients who are interested. They can just call the office and say, "Hey, I heard about this on the radio. I would like to be, considered for the study." That would be awesome.
Okay, well, I'll put that out there. nvadvancedpain.com is the website. nvadvancedpain.com is the website, and we'll give the phone number.
Yeah, if you want to call our office, it's area code 775-284-8650.
And we'll give that again,
775-284-8650.
Great. nvadvancedpain.com, and I'll put that on the website as well. On my
Watch Party.
The Watch Party page, as well as the Rush Hour radio show page, and I would like to possibly be considered for that too.
Yeah,
we'll see if I might qualify. But that's awesome. I love medical research, and I think it's really important for just in general, for whether it's for drugs or for costs or whatever the situation is, just to find out,
it's the only way we can learn to take better care of people.
Absolutely. So again, if we'll talk more about this on the other side of the break. We'll be back for the fourth and final segment of today's Rush Hour with Kelly Rush and Nevada Advanced Pain Specialist Dr. Dennis Patterson and Flowonix Renee Swackhammer. We'll be right back.
Adopt US Kids presents What to Expect When You're Expecting. A teenager. Learning the lingo.
Today I'm going to help parents translate teen slang. Now, when a teen says something is on fleek, it's exactly like saying, that's rad. It simply means that something is awesome or cool. Another one is totes. It's exactly like saying, totally, just shorter. As in, I totes love going to the mall with Becca. Another word you might hear is jelly. Jelly is a shorter, better way to say jealous. As in, Chloe, I am like so jelly of your unicorn phone case.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will think you're, rad just the same. To learn more, visit adoptuskids.org. A public service announcement brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
I spend a lot of time in the garage, but even more time in the rain, sleet, and mud. In 95, I helped tow your moving trailer. In 05, I helped you get out of a ditch. Yeah, I know I'm a bit rusty, and sadly in 09, it was sparks from me, your handy chains, dragging behind your truck that accidentally started a wildfire.
Sparks from dragging chains can start a wildfire. Spark a change, not a wildfire. Visit SmokeyBear.com. Brought to you by the U.S. Forest Service, your state forester, and the Ad Council.
Only you can prevent wildfires.
1 in 3 adults in America have pre-diabetes, but most don't know it. To let people know it can be reversed before it becomes type 2 diabetes, professional basketball player Julius Randle is doing everything in reverse.
I'm only dunking with reverse windmills. I drove the whole way to practice in reverse. I don't recommend it. This move's called the reverse shuffle. I do recommend it. And it took me months to learn how to speak in reverse, like this. Years 10 almost for diabetes type 2 with living Ben has mom. In other words, my mom has been living with type 2 diabetes for almost 10 years. So together, we want to say to the 84 million Americans at risk, exercise and healthy eating can help reverse prediabetes. Start by taking a simple 1-minute risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Bet he can't say that in reverse.
This is America Matters Media on AM 1180 KCKQ,
A Lotus broadcast station. The power of radio since 1967.
Unable to listen to the whole show? A recording of today's program will be available later today. Visit americamatters.us and click on the podcast link. Now, back to the show.
And welcome back to the fourth and final segment of today's Rush Hour. I am your host, Kelly Rush, and it is Third Thursday, my favorite day of the month. And we are here with Nevada Advanced Pain Specialist, Dr. Dennis Patterson. We've got Nicole Mongelli to my right here, the Director of Marketing. And we've got across the way, Renee Swackhammer of Flowonics. We're talking about pain pumps. But first, I want to say nvadvancedpain.com is the website. And there are 2 locations conveniently. One is the main location, which is 5578 Longley Lane, and also in Sparks, which is at the
Northern Nevada.
Thank you, Northern Nevada
Building.
Medical Building, which is where the Northern Nevada Hospital is, which is the medical center, which is right across the way there. So 2 very convenient locations if you need any kind of pain management. Just go. Just go. Nevada Advanced Pain Specialists, nvadvancedpain.com. There are so many different kinds of treatment available with this practice that you just, you're not going to get just one kind of treatment thrown at you. You're not going to get just here's a bunch of drugs, go away. Here's just surgery, go away. You are going to get a complete consultation and find out what it is that you need. And that's the beauty of this practice, and that's why I do this with Dr. Patterson every month. 775-284-8650, 775-284-8650, nvadvancedpain.com. And now let's go back to talking about pain pumps, which is why we're here today. And so what is the most important thing people should know about pain pumps?
Probably the most important thing to know is that it can manage your pain effectively without, being tied to taking something through the mouth. And I think that's where a lot of patients get confused, is they think the only way I'm going to get pain relief is if I, take an adequate supply of medications. And, I see patients all the time that I'm like, man, the medications you're taking through to cover this pain, it's almost like a meal, 3 times a day.
I think you said the key right there, cover the pain.
Yeah.
And I think that's what a lot of oral medication does. It just kind of covers the pain. And I think with a pain pump, that's not the situation. I think with what you've been talking about is these multifaceted, different types of medications that are available for use with this. That's not what's happening, because you're avoiding these brain receptors.
Yeah, or
and not having to metabolize it. I think that's so key.
Let's say you have like a surgery on your upper extremity, and it was pretty extensive, like you had cancer debulked or something like that. And so now you got the pain in that arm. You take the oral pill, not only does it go there, but it goes through everywhere else, right? And if we know the nerves that cover that arm, we can put the catheter for the pump to cover those nerves specifically. And so now it just treats that area of the body. It doesn't have to go, through the other 90% of the body where it isn't needed.
Right.
And so you can concentrate that treatment there and give that patient more relief at much lower doses than what you do, orally. As I said, it's a 300th of the dose, if you do the conversion. And so therefore, I've got patients who, I believe in the algorithm, it's called microdosing, especially in chronic pain patients. And so literally, if the pump was to turn off or something was to happen, they wouldn't go through withdrawals. They wouldn't even, their pain would just increase. So it's much safer too than the oral medications, because the oral medications, even if you take them properly and your health status changes, say you develop a UTI or pneumonia or something like that, and the way your body fights that infection, sometimes it can't properly metabolize that drug. That drug can build up in your system, and the consequences can be deadly. It can build up to the point where now you got an accidental overdose.
Well,
And
sure.
you're taking your meds as prescribed.
And then you have these potential interactions with other things that you take, too.
Like the antibiotics to treat the infection.
And, accidentally, you have no idea.
Yeah.
You're taking your stuff as prescribed, and then suddenly you get sick, or you go to a different doctor for something else, and they prescribe something, and you don't realize, or you forget to tell them that, I'm on this too, or whatever.
Yeah.
They start prescribing this for whatever condition. You take that, and boom.
And so this medication getting in there, one, it doesn't have to go through those metabolism channels, so it doesn't have to compete with any other meds your doc gives you or that you get put on that you don't think about. So that's the other thing. And two, it's at such lower doses that, even we have some patients who are on a pump, we get drug screens on them, and it doesn't even show up in there because it's such a low dose, and yet their pain is covered.
Sure.
Yeah.
Sure. Wow, that's amazing. And so how?
And again, on that, like think about people that have to go to work.
That's exactly right.
There's drug screening at work, and
Sure.
So
absolutely,
something else that doesn't show up.
People like
and being able to work.
First responders.
Yeah.
Medical professionals.
Correct.
People who have key jobs.
Yeah.
That need to work. And need to be able to perform
and think
and operate at optimal levels, but have these conditions that and they don't want to give up their careers.
No, they don't.
And suddenly they have an
just
injury.
working.
Right.
I mean, the whole your entire lifestyle, being able to function and not
Ex-
feel drugged all the time.
That's exactly right. And something happened, they get in a car accident, or they fall, or and they're facing their life being over, and all of a sudden here is an option. This is a literal lifeline for them.
Right.
Yeah.
And
And I've seen patients who, are pretty disabled due to their pain, but we go ahead and we get them the pump, and their pain is better controlled. They seem to get more function and mobility, and then they can go back to trying to work or enjoy hobbies that they previously could do that they could no longer do.
Absolutely.
I know of one patient, when I was speaking with him, he was just so thankful because it really changed his life. For I don't know how many years he'd been pretty much debilitated. I think he was born with spina bifida or something. So, he'd always been struggling with this. And once he finally got the pain pump, his pain, was addressed. And he was almost in tears when he said, I was able to take my grandson and I took him to a concert and put him on my shoulder. He was just so thankful because he was able to do what a lot of us take for granted.
Sure.
And those are moments in life that are treasures.
Absolutely.
It is. And you don't realize until you can't do it. And he was just really thankful for that. And that's the hope of addressing the pain.
Absolutely. And how did you get into working for this company, Renee?
Well, I'm actually a nurse.
Oh, wow.
parameters. But there was an opportunity, and interesting you say that, because I actually have a strong interest in functional medicine, functional lifestyle nutrition, and just all of that, and the way the medical model works. I don't really like how our medical system has somewhat trained us. You go to the doctor, you get a script, and, you know, with all due respect, that's some ways what you need to do. But like with Dr. Patterson, the whole, it encompasses, as I call it, the pillars of health, like the whole system, the whole body, which is functional, and because it all plays into it.
It does.
All of it.
Absolutely.
And so the pain pump was an opportunity, and I've really, really enjoyed working with Dr. Patterson and all of his staff, and I adore the patients.
Sure.
And
well, the mindset is changing. You know, I mean, things are changing in kind of just how people think about treatment, how people think about pain. You know, this whole quote unquote opioid crisis kind of shook people out of the, you know, the here's a script, here's your pills, goodbye, you know, model. But
people still need it addressed.
But people still need it addressed because people are in more pain than ever. Our generation, I'm not sure how old you are, but Gen X is very sick. We're, you know, because we've worked our asses off. We have been working forever, and we are going to have to for a very long time, and our bodies are breaking down, and we're learning how to build them back up, which is a wonderful thing. And as we learn more about it, but in the meantime, we're going to have to learn how to cope with the pain in the meantime. And we have great options now, and that's a wonderful thing. And thanks to doctors like Dr. Patterson and the biopsychosocial model, we are learning that, you know, the brain-body connection is a thing.
Huge.
And how to work with it, and that pills are not the answer, and necessarily, you know, that's not the only way to go. So
treat the whole person.
You got to treat the whole person, and that we've got to keep our minds clear, but that we still have to, you know, keep our bodies healthy. And so this is a great way to do it. So thank you, Renee. Thank you, Dr. Patterson.
Thank you, as always,
Nicole.
Kelly.
Thanks for having us.
Excellent.
We'll see you next month.
We will see you next month. Thank you so much. And next month it's going to be, I believe, fourth Thursday.
Correct.
Because you're going on vacation.
That is correct.
So enjoy.
Much deserved after today.
Much deserved after today. So thank you so much, everybody. Have a wonderful night, and I will see everybody tomorrow.
Awesome.
Thanks.
Thank you.
Appreciate you.
Thank you.
No word in the English language is less convincing than probably.
Are you sure we should get matching tattoos on our first date?
Sure.